Hello, and welcome to the Nurse Linda webinar for the month of February. I'd like to thank you all for coming. I'd like to thank all the support people that you don't see. You see Ms. Hill interpreting there, but there's a lot of other people working in the background, and we're always grateful for their help in getting this all together because I'm a nurse. I'm not a technical kind of person. First of all, I'd like to say that I'm a lightly pigmented skinned woman with brown hair, and today I've got my pink rim glasses on and a gold shirt. I have a navy blue background with the Reeve colors on it, which is very nice. And speaking of the Reeve Foundation and the Reeve family, tonight Will Reeve is having his special on ABC. Check your local listings. I'll be watching. He's going to be taking a journey that his father took years ago, and so he's finding his father along the way. Anyway, I think it's going to be quite poignant and really wonderful to see. And just as a sidebar comment, all three of the children are just so spectacular people and so committed to paralysis and research and, just the whole organization and everything. So they're just wonderful people all together. So raised by good parents, as you can see, so that we have that going on tonight. And then also, I wanted to mention March 10th through 12th. The Reeve Foundation will be having a summit in Denver. So if you're in the Denver area or if you're someplace else and you want to come to Denver, be sure and come. You'll get to meet all kinds of people from the Reeve Foundation. And I will be there as well. So I'm really looking forward to doing that. So just something I wanted to talk about real quickly while we start. This is too close. This is one of the wallet cards that the Reeve has. They're absolutely free. This one is on deep vein thrombosis. There's also one on autonomic dysreflexia and one on sepsis. And these are three situations that are emergency situations. And so a lot of times, maybe you might go to the hospital, you might go to a new doctor, a specialist, or something. Maybe they've never worked with somebody with paralysis before. And so it's nice to keep these three cards. You can get them laminated like this one is from the foundation, or you can get them, you can print them off free. And I always tell everybody, just print them off and hand them out like candy. So I know somebody had a question about educating their caregivers, and these are three cards that's a good place to start because these are emergency situations that people might, especially autonomic dysreflexia, they might not have heard about. But deep vein thrombosis is a problem that affects people with spinal cord injury because of pressure on their legs or on the arms. Don't forget the arms. They can also form in the abdomen. They can form anywhere in the body, really. But a lot of times, because of problems with sensation, you might have your legs crossed, and that pressure in there might occlude some of your blood vessels. Or you might be hooking your arm around the back of your chair. It can even be your clothes are too tight, especially when people were wearing those real tight, skinny jeans, and they would like dig in the fold where your torso and your thigh meet, and they would cut off the circulation there. And so you can get DVT from all kinds of things. So it has all the info. This trifold is like the size of a dollar bill. It can fit in your wallet. You can take it anywhere you want to go. It has information about what it is on the front. It has information for your healthcare provider and the symptoms and then what the treatments. So it's really very handy for these medical emergencies. Be sure and get those three trifold cards. So I really like them because they're so handy. And then also, if you go in and what's the problem? Well, I'm not sure. I bumped my leg, and sometimes people just they get their leg trapped in their wheelchair, or their hand gets caught in their wheels or something. And anyway, there's just a whole variety of ways that you can get. Sometimes people are just rough with their body parts and they just throw them up. You're getting to bed and they just throw their legs over there. But this is your body. And even though you might not feel it, you need to take tender, loving care of it. So, there are all kinds of things that can happen. So be sure and get those cards if you can. We do have a bunch of questions today, so we'll just jump right in. What's the name of the instrument to help people without adequate strength to cough to expel secretions? And they know about the cough assist. That's an insufflator, exsufflator. So some people don't like to do suctioning. It can be it can just be hard on them. Some people will get an insufflator, exsufflator, and it kind of pulls the phlegm out of your body. It's kind of a little bit hard to get used to, but if you get used to it, some people prefer that over the suctioning, but they're not looking for that one. But I just wanted to mention it for people who were not familiar with this particular line of medical equipment. But this person had seen something with electrical stimulation. Do you know what I'm talking about? Well, there's a lot of things that are helping now. Electrical stimulation is the thing right now, which is quite wonderful. It's really advanced a lot of medical treatments in a huge amount of different ways. So it is really very helpful. And so sometimes people will use external electrical stimulation and they'll use that to help the diaphragm move more. There's also internal stimulation devices where there's a vagus nerve stimulator that will help you cough better. Um, without and there's a variety of different products. So if you look up electrical stimulation for cough, you'll see all these different products that there are. And, some are external, some are more internal. There's the diaphragmatic pacemaker that we talked to Dr. Cruz about on the professional webinar. You can see that on the YouTube. That's an implant, a surgical implant that helps the diaphragm work better so you have better breathing, you can do some more coughing, you have a louder voice. So that's some people are no longer ventilator dependent because they have this diaphragmatic pacemaker. Some people will use their pacemaker during the day, but go back to the ventilator at night. So there's all kinds of options. Now that's even more than just coughing. It just gets down to breathing. If you want to help strengthen your cough, and a very simple thing to do is to get a series of straws, and I always recommend you talk to your healthcare professional, your therapist, before you get involved in any of these things. So if you want something for cough and you're looking online and you think, oh, this is the thing that I want because I see that this has this advantage or that advantage. It's good to educate yourself. Please be sure and do that. But also talk to your healthcare professional because there might be one product that might help you better than another product. So just because you read about it online or your friend has one or something, be sure and look at the whole market of what's available to you so you get the one that's most correct for you. But going back to the straws, you can go to get a smoothie straw. They have a rather large, and just practicing breathing in and out of that a few times. And then you can go down to like a regular soda straw. And then people will usually go down to like a coffee stirrer swizzle stick. And as they're breathing in and out, it really helps build the strength in their lungs. There's also a device online that's called a power lung. It works, it's a single device. It's not a straw kind of thing. You buy it, and that helps you breathe in and out against resistance. And so that helps strengthen your lungs. And then there's also something that you probably got when you were in the hospital called the incentive spirometer. If you still have it, it's probably still in the package, but there are nurses like me that will be like ripping that package open and saying, breathe on this. And you think you want it has three balls in it that go up and down. It might sound familiar to you, and you think, oh, I'll I'll breathe out and the balls will go up because that makes sense, right? But you actually breathe in and the suction makes the balls go up and you can build up your lungs over time. So there are a lot of products. Some are electrical stimulation, some are not, some are purchase device, some are just straws. You go someplace, you pick up some straws and they're kind of nice to have. Um, Current treatment for spinal stroke affecting, and then it's cut off. So I don't know if it's like the eighth thoracic vertebrae or the eighth cervical vertebrae, but spinal stroke, a lot of people don't realize until they're confronted with it that you can have a stroke in your brain, but the nervous system has the spinal cord in it as well. And so you can have a stroke in your spinal cord. It's a little different than a spinal cord injury, but it's more like a spinal cord problem from disease because it's a medical complication of having the stroke. And so there are all kinds of treatments. They are the same treatments that are given for any kind of spinal cord injury. You just have to get the right treatment for you. So you'll need to um, talk to your healthcare professional. If you haven't had rehab, you want to get some rehab. If you have it a while ago, there's outpatient treatments. There are therapists that will come to your home. Your physician just has to order it for you, but you need to have some evaluation and then continue with treatment. If you're out of the rehab center, they give you that great big binder with all your exercises and all your things to do. Be sure and go back and look at that big binder. It's so overwhelming at first that people are kind of like, oh my gosh, this is just too much. But, if you've been out for a while, it's kind of time to revisit that and make sure what you're doing is what you should be doing. So, all the treatments are available depending on your payer source, but the electrical stimulation, you can try that. Just about anybody who has paralysis from any issue, so it could be from spinal stroke or neurological disease, can go to the can go to your therapist, go to your healthcare professional and ask for 2 weeks of mobility training. Now, that doesn't mean that it has to be mobile. You get 2 weeks per year. So that does not mean that you go and, like, well, I can't possibly walk, so that isn't for me. Mobility training can be how to use your arm better. That's using your arm as mobility. So there's all kinds of different kind of things. Maybe helping breathing better. That's mobility. So it really is it encompasses just about everything. But you can get 2 weeks a year now. It doesn't have to be 2 solid weeks where you go every day. It might be 1 day a week, it might be 2 days a week, it might be 1 day a month, and then you might go 1 day a month for the whole year. So there's all kinds of arrangements that can be made, and so be sure and check into that. There's a question, can you order the plastic spirometers on Amazon? You sure can. Now, I will tell you, they used to cost about 10 or $12. Now they cost about 20 to $25. And that was since the COVID. When the COVID came out, everybody was getting an incentive spirometer to help strengthen their breathing. So in case they got the COVID, that would do better. So yeah, that is something that is just kind of interesting to me because they were very inexpensive. They're not really, really costly now, but it just like the price just doubled over COVID. So that's kind of an interesting thing. Um, back to the blood clot issue. Can a vena cava filter prevent a pulmonary embolism? It can't prevent a blood clot from forming, but it's a filter that goes in one of the main blood vessels usually in your legs. You can also have them placed in your arms as well in a big blood vessel. It is kind of a risky procedure, so you want to think about that carefully before you do that. Now, sometimes your doctor will just say you need to have this. They go kind of in and out. In healthcare, there's a lot of things where sometimes people say, yes, we really need to have this, and sometimes they'll say no. There are some risks from having them. There are risks for having them put in. So weigh your risk and benefit. But what they do is they filter the blood so that that clot cannot travel to your heart, your lungs, or your brain, causing really serious medical problems. So it doesn't mean run out and get one, but there is one treatment for the deep vein thrombosis. Blood thinners is another. The those elastic stockings, those thrombolytic stockings, because they apply compression to your legs. You can also get them for your arms. but they apply compression so it helps that blood flow so the blood doesn't get kind of stagnant down in your blood vessels in your legs and arms. Also, abdominal binders help as well. So that helps from getting one in your torso there. Um, Somebody hears they have a son and they are having trouble with it with their authorized nursing service. And so their person had gotten sick, and it's a regular person for Friday, Saturday, Sunday. They got sick and they haven't been replaced. It's been 5 weeks. Whoa, that is a long time because that means somebody else is having to do that. I'm sure that probably is falling to the mom. So you need to talk to your insurance company, call them, or start with the agency where the nurse comes from. Now, if you're hiring independently, um, you'll have to, find somebody else. But if then you have to find somebody on your own. But if you have somebody through an agency, that agency should be providing you with somebody. Now, I know that finding caregivers like this has been very, very difficult again since the COVID. I don't mean to be yammering on that all day, but that's when things kind of went south on finding people to come into homes to help. But you need to get on that right away. So call the agency. If you don't have your regular one, they need to replace that person. And if they don't have somebody, then you need to get organized with another agency for this particular time period. Now it's been 5 weeks, so you need to be really careful because if your insurance sees that you haven't been billing for this for 5 weeks, they're going to say, well, gosh, you probably don't need it then. And you might lose that benefit. So you really need to be aggressive with the company. And, by aggressive, I mean mean and, hateful, but you need to be calling them every day. Could you give me a follow up on this tomorrow? We're really desperate. We're having a lot of trouble here. It's been way too long. We need to get going on this. And so they need, agencies. If you have a contract with an agency, they should be supplying that person. You might have to go with somebody different for a couple of weeks until you get into your regular routine. And then, you're kind of retraining somebody new and it gets to be a hassle for you, but you need to get somebody in there so that continues in with the whoever's paying for that service. The next one is somebody who has bowel and bladder function. They're quadriplegic, but they need a liquid suppository. But they never feel like they fully evacuate, and they're interested in maybe getting the MACE procedure, which is a procedure that is a surgical procedure where a little stoma is placed in your abdomen and then you basically flush out the bowel. So not a lot of people have it, but some people have it. Again, it's one of those that go in and out of vogue because it's more of an enema type procedure where the bowel is flushed out. It may be the thing for you. It may be something you read about online, but there are a variety of other things that might be more beneficial. So be sure and talk to your doctor about the risk and benefits and about all the options that are available to you to make sure that it is the right one for you. Now, sometimes, not a lot of people, but that you're at the C5 level, and sometimes people feel pressure in their bowel because they just feel something. They feel something, and so it feels like this pressure, and it's really kind of irritating. It's not a lot of people it happens to, but some people have this kind of weird like sensation thing that's going on. It's kind of a good news, bad news story because if you're feeling something, that means you have some message that's getting through your spinal cord injury. That's the good news. The bad news is it's irritating you so much. It could also be um, spasticity or tone in your bowel. And so it might be that you could eliminate that with some spasticity or we call it tone now, but everybody knows it as spasticity. So it might be if you have a little medication that could just take the edge off of that. It might be that maybe you need an anesthetic that's put into the bowel before you do your bowel program that might relax that tone. If you have tone on the outside of your body, if any part of your body, like your legs are spastic or you feel your arms spastic and you can see that tone, then you probably have tone inside your body as well. It's not a given that one equals the other. But if you see it on the outside of your body, it's probably on the inside of your body. So there could be some tone there. And maybe another option also is maybe the glycerin suppository is not strong enough. For adults, it people usually use the Ducalox or the Magic Bullet. It's a little bit stronger. And so maybe the glycerin suppository, which is used more in children and older people, maybe that glycerin suppository just isn't quite doing the action that you need there. So there's a lot of options. So you'll need to talk to your doctor and kind of ferret all this out before you jump into a surgical procedure. So figure out what the problem is. And then if you still want to do a surgical procedure, talk to your healthcare professional about a MACE or any of the other things. There's also a device that's flushes out uh, the bowel called the Pristine system. That's a little more aggressive and it flushes out the bowel. So that might be something that you might want to do. I'm not trying to talk you at all out of the mace. I just don't know where you are in this process. And also for our other listeners too, everybody needs to know that there's so many options. The bowel program, is also an issue. Be sure you get the bowel program book that the Reeve Foundation has because it goes through a list of troubleshooting. So sometimes people want to stick that suppository in as quickly as they can and get out as quickly as they can, and they don't put it up against the bowel wall. So if it's not against the bowel wall, it's not going to dissolve and it's not going to fully evacuate the bowel. If you follow up with digital stimulation, now some people just elect not to do digital stimulation and then they have a lot of problem with their bowels. So you have to follow up with the digital stimulation. Again, people want to get in and get out real fast and they swirl as fast as they can. That's tightening the bowel. It's irritating the bowel and it's tightening. You want to do it very slowly with a heavily lubricated glove finger and just relax that bowel. And you'll actually feel the bowel relax and then the stool will come out. Shortens the bowel time, works like a dream. But usually people have all these little things like, yeah, I really don't want to be doing this because I've yet to meet the patient who said, oh, goody, I get to do a bowel program. It's like, hey, what are you talking about? So that's more the answer that I usually see from people. I've not had anybody be delighted in that process, but it's something, it's part of life. You get used to it, you do your thing. We all want a shorter bowel program, so get that bowel book and it will be coming up here, I'm sure, shortly, or maybe what I need to do. Maybe our information specialist has already put it up there, but I haven't rolled down far enough yet to see. I thank you for that. So that's a great see, it's lovely to have people who are helping at all times. Bowel management is right there in the chat box. So, okay. The next one is somebody asking about a product called Photozyme. It helps break down trigger foods in the bowel. It is a product that was devised for IBS, so irritable bowel syndrome. Now, will it help for somebody who has a neurogenic bowel? And I found an ad that said it worked for people who have spinal cord injury. But sometimes people who are selling products don't know that people with spinal cord injury have a whole different bowel issue separate from irritable bowel, separate from constipation. It is a nerve issue. It's not any of these other problems. It's not just constipation. Some people say, oh, I'm so constipated. Well, you can still have constipation, but your problem is a neurogenic bowel. You can still have irritable bowel syndrome, but your problem is still neurogenic bowel. So you can have other problems. You can get an ulcer in your bowel. You can have diverticulitis. You can still have problems, but you still have neurogenic bowel, and it has to be treated as neurogenic bowel, which is the bowel program. But I understand with those trigger foods and you get real worried about, uh-oh, I can't eat this and I can't eat that. Sometimes those trigger foods can be helpful in eliciting and supplying effect in your bowel program, but usually those trigger foods come out at times when you don't want it to come out. Now, I did see about the Photozyme, it contains a lot of sugar. And so you might want to reconsider that because it breaks down into sugar, which makes the bowel move quicker. If you're diabetic and you eat a lot of sugar, you will have a loose stool. And so, because diabetes affects the bowel, but if you are at spinal cord injury and you have diabetes, that's a common complication of spinal cord injury, or and different types of paralysis. So you want to avoid, taking big boluses of sugar in so that you're not challenging your body with digesting all the sugar all the time. So if you want to try the Photozyme, talk with your doctor first, make sure it's the right thing with you. And he might say, well, try it and see how it goes. And, but always check first because when you're taking something that may or may not be the treatment for you, sometimes people get things, this is an over the counter, it's a dietary supplement. People think, oh, it's a supplement, it'll be fine. It might interact with some of your other medications. It might cause you to become diabetic. It might irritate your bowel more than not. When you have paralysis from any source, from something in your head, something in your spine, neurological disease, your bowel tends to slow down because you're not up moving around, moving your legs. If you exercise your legs more, that certainly helps stimulate your bowel because even if you're just, manually moving your legs, or if you're doing a treatment that's moving your legs, that will, the muscles all work together. And so that will stimulate the muscles in your abdomen, which helps your bowel function. So, that's a good place to start. Oh, people want to, oh, my leg exercises, I either have to get somebody to help me or I have to do it. My legs are really heavy because everybody's legs are really heavy and picking them up and moving them around can be a real challenge. But it's one of the most important things to do because it's helping your body, it's helping your circulation, it's helping you breathe, it's helping your bowel program. It helps you keep from urinary tract infections because your bladder's being shaken by those muscles as well. And so it's really important to do those exercises even though I know it's been a while, maybe for some people since they've done it, but it really is much to your benefit. Here's somebody who's I don't know if they have a spinal cord injury or if they have paralysis from another issue, but they're having a hard time. Um, it's pain is the situation that they're writing about. And so, be sure and talk to your doctor because they've been away from work for a time and we're trying to get in the painters union, but they have pain. So be sure and talk to your healthcare professional because they can help you with pain control, but there are also doctors they can refer you to that do nothing but pain control, and they can give different amounts of medication than you can just get. So be sure and talk to your doctor because living with pain is no way to live. It's really, really difficult and it's a challenge. And when you can't work and you can't be with your family, it gets very depressing. And it sounds like maybe you're having some trouble with that because the pain just has consumed your life. It's miserable. So talk to your healthcare professional. Maybe they've tried different treatments. Sometimes there's injections they can do. There's all different kind of things, but there are these doctors that do nothing but treat pain. And so you might be at the point where you just need to get on some kind of regimen that will help with that pain. And I know it's kind of a short answer, but I don't know what the pain source is. So I hope that that will at least give you a guide of someplace new that you can turn. Um, is it true that if a male 28 has a thick, like bubble dusters in their urine, that it's a sign of kidney trouble? Um, It can be a sign of kidney trouble, but it doesn't necessarily mean that it is. You need to have a urinalysis to find out what it is. Some people just seem to have some little bubbles in their urine, which is more from expelling the urine than from making the urine. Sometimes, especially when you look at the urine, if it's in the toilet, sometimes you'll see like little bubbles in there. That's just the force of the urine hitting the water. So that it can mean nothing, but it can mean something. So is it true? Well, it could be true, um, but it doesn't necessarily mean that it's a sign of kidney trouble. So if you're concerned about something, be sure and talk to your doctor about it. Sometimes people have sediment in their urine and that looks like little white pieces. Now, if you're going into the toilet, people don't usually see it because toilets are usually white, and so you can't see it. But if you're catheterizing, people will see sediment in their urine, and that's just because you're not up walking around and stirring up that bladder. So it tends to the little pieces of excrement, people think, oh, only fluid comes out in your urine, but there can be dead blood cells in there, and sometimes they look, if they settle together, it'll look like sediment, means really nothing. Sometimes people will have some extra calcium in their urine, which might be a problem that your bones are excreting so much calcium, and you might see something that is sediment that could be calcium, so you need to check into that. It might be a bone problem. Sometimes people have sediment because they have a urinary tract infection, and they'll know, people that deal with that a lot, they'll know that could be their trigger that they'll know, oh, I have a urinary tract infection because I have this sediment. Now, it's also true that you can have a urinary tract infection and not have sediment. It's just some people, people's bodies are all kinds of different things. So if you're concerned about these bubbles in your urine, have it checked out because that's the only way you're going to know. But I just suspect that it's probably just maybe the urine hitting the water in the toilet. That would be the most pleasant outcome in this situation. There is another drug that somebody would ask about, and it's Myabergine, and you'll see it advertised on TV, and it's for symptoms of overactive bladder. And so that is what it treats, overactive bladder. Now, if you have a paralysis from a spinal cord injury or from a head injury, you could have um, overactive bladder because it's caused from neurogenic bladder. So there's all different kinds of medications that you can be given if you have an overactive bladder because it's an outcome of neurogenic bladder. And there's medications. This is one. Oxybutynin is another one that's more common that settles that overactive bladder. Some people just have an overactive bladder from age, or they have nothing wrong with them except they have an overactive bladder, and that is the diagnosis. And this medication is for that. However, um, if you have an overactive bladder, you need, instead of just taking this medication, you need to find out if you have a neurogenic bladder because you want to treat the problem, not the symptom. You want to get to the heart of the matter. And so be sure and check with your physician. It might be the treatment for you. Overactive bladder means if you have bladder sensation, it means you have to go right away. If you have neurogenic bladder, then you might have a urethra inside the bladder. There's the external one, and then there's an internal one that's right at the base of the bladder. And sometimes that's not working in unison with the bladder. And so if the bladder's squeezing because it's overactive, but the sphincter down here is also overactive, it's slammed shut and it's not opening, then you might have a problem with the urine backing up the ureters into the kidneys. So you need to have that checked out to make sure that you're getting the right treatment, that you save your kidneys because, if you lose a kidney, that's pretty bad. And if you lose both kidneys, both damage, then it would be dialysis, and that's a whole nother thing. Now, sidebar comment, this is completely sidebar to your question, but there is a lot of research going on with genetically altering pig kidneys so that people who are on dialysis can get this pig kidney. Pig is the most compatible animal with the human being. That's where we now insulin is made in the laboratory. It's manufactured, but that's where we used to get insulin because we didn't have body reactions. We didn't have that rejection with insulin when it was first devised. It came from pigs. I had an uncle that died from diabetes in 1932, but because of that I've been interested, in all these things about diabetes. And so lately they've been doing, it's been on the news, so it's really intriguing because there's a lot of controversy about growing pigs to, serve humans. So it's very controversial, but they've done trials in humans, and they did one in a lady who was 2 years on dialysis, and she got it put in, got it in, worked like a charm. She doesn't have to do dialysis. How wonderful is that? Now it's just at the infancy stage of research. You can't go in and order up a pig kidney, but it's coming, and it's coming really quickly. Things are developing so quickly. It's kind of marvelous. Anyway, I get all excited about these things. I think it's just wonderful, that people worked on this and are really helping other people. I love it. Okay, somebody had a colostomy a year ago and they developed a diversion colitis. How long does someone have to use? Uh, I think it's supposed to be suppositories. Um, so that really depends on how long it's going to take to cure this colitis. So something they've had a little diversion, and they've had a little something that's developed kind of off an offshoot of this. And so it's going to depend on how long it's going to take to have that healed up. But that can heal up. And so it's been a year now. That's a long time, but that's not unusual either. So I really have no estimation on how long that will take, but it will heal up over time. So keep doing what you're doing because it's important, um, to keep that all in process, not to let that slip behind because you don't want it to become worse, is what the issue is. So let's see. Somebody is talking about suprapubic catheters and what's recommended, irrigation a week, or does it depend on the person or personal preference? Well, that's a very good question. So suprapubic catheters are an option. A little hole is placed um, in the lower abdomen, right above what we call the pubic symphysis. So in your hips and your pelvis, there's this bone that kind of scoops across your body, hip to hip, and it's it holds the torso, the bottom of the torso structures. And so right above the bone that's right up in front of the bladder, they put a little hole through the abdomen and they put a catheter in there. Now, some people will say they do it a lot in higher level people because of autonomic dysreflexia, so that intermittent catheterization sometimes works, sometimes it doesn't. Sometimes they do a sphincterotomy, which is a little cut in that internal sphincter in your body, and then urine just flows out all the time, and you wear an external catheter. Sometimes women have these done because it's such a challenge to catheterize when you're sitting in the chair. For males, the anatomy is different. It's easier to catheterize, but for women, sometimes it's harder to catheterize. Now, it used to be that people avoided the suprapubic because they were afraid it would be such a higher level of infection. But what the recent research shows is it's about the same as intermittent catheterization. That's new information. So a lot of people who aren't into research really don't know that kind of information. But if you have a suprapubic catheter, and that's the question, what's recommended? Sometimes no irrigation is recommended. Sometimes irrigation, when the catheter's changed, or it might be as needed kind of thing. Sometimes it's once a week, sometimes it's once every other week. So it really depends on the person. It is not by personal preference because you can't just do it as you need to do it. Now, sometimes if your catheter gets clogged or something, your doctor might say, well, go ahead in that situation and do it. Sometimes it's on a regular time schedule. So there's all different kinds of information about irrigating the suprapubic catheters. And again, as I say, some people never do it. So it just really depends on what's happening. If it is recommended for you to do it, you need to do it as you're recommended to do it because you don't want to be doing it too frequently. It depends on what solution you're using in there. Sometimes you put the irrigation in and it just comes right out the catheter. It's just kind of like a wash in the bladder. Sometimes you put it in and you clamp the catheter and it stays in there for so many minutes. And so it's a process that's different for everybody, but you need to follow the instructions on that. It just doesn't come automatically though. So it's one of those things that's just so unique to everyone. There are other options too. If you don't want the suprapubic, they do a mitrofanoff, and it's usually done with. It started out being done in children because catheterization in children was difficult for kids to learn. But they take a piece of the appendix and attach it to where the belly button is, and then the catheter goes in through the belly button and down into the bladder, and the urine is drained out in that way. And so for women and for children, it's very easy. For men who have maybe a tummy that's overhanging and they can't get to where they need to go, or if they have a retracted penis, sometimes they'll will get that. So it's another alternative there. So there's all kinds of different alternatives. Urostomy is like a colostomy for the bladder. So there's all different kinds of things. Now, the next person who writes in, have you heard of posterior spinal cord syndrome? Well, there's a lot of different spinal cord syndromes, and it's kind of interesting because unless you see them, they're kind of rare. And so unless you see them, unless you work like in a rehabilitation facility, you might never see one, or you might see one in a lifetime on a neurology floor. It's kind of a rare thing, but it does happen, and there's a whole bunch. This is posterior, so it's in the back of the cord. There's also anterior, which is in the front of the cord. Um, there's central cord, which is right in the center of the cord, and they all have different outcomes. There's Brown-Séquard syndrome, which has you feel on one side, but you have movement on the other side, and it's back and forth. Transverse myelitis is considered one. Conus medullaris is way down at the end of the spinal cord, which just affects bowel, bladder, and leg function. And so there's all these kinds of spinal cord issues. I had to get out my cheat sheet because I didn't want to forget any of them. So he says, how do you teach other people if you don't have sensation, but you have muscle and bone feeling? You have strength, but you don't have space awareness, and that is posterior cord. So the Reeve Foundation I wrote a blog about all the different cords syndromes and what they mean and what they are and what they do. So if you go back in there and search in the Reeve Foundation for posterior cord, or just write in spinal cord syndrome, and the information will pop up to you. It'll probably be coming up here, but there's all these information sheets. So you can look up anything at the Reeve Foundation. So if you have that information sheet and you want to teach people about it, that's a good place to start because it's written on a level where anybody can understand it. It's not medical mumbo jumbo. So, it's written, it's a friendly read, and it will help you also be able to work. You will probably have to explain it to every single person you meet. If you go in for an x-ray or something, you probably have to tell them, but whip out that piece of paper, take a highlighter and show this is the one I have. So hopefully it will help because it's just one of those things that's so uncommon. That people just are not that familiar about it. Did we all learn about it in medical school and nursing school? Of course we did, but if you never see one and you've been a nurse for 40 years or you've been a doctor for a long time, it might not be fresh on the brain. So print that off, carry it with you, and you'll be able to communicate with people as you need to. Here's a person who has 81 years old, can no longer transfer to the commode for bowel and bladder. What alternatives would you recommend? So, if you want to use a shower chair, if your home's accessible, you can transfer. Sometimes people will use a shower chair and transfer into that shower chair. Sometimes they will get a Hoyer lift. That's very helpful. Um, if you can't go to the commode is great for bowel and bladder because in that case, gravity is our friend. Gravity can be such a bother, a detriment, because when we try to do something, we're always working against gravity. Like if you move your arm this way, it's much easier than to move it this way, because this way we're against gravity. If we're just going like this, we can slide it across the table. And sometimes people can take advantage of that because we're not working so much against gravity. So the alternatives would be to get some kind of transfer system. Now, at 81 years old, you should be able to go to your healthcare professional, tell them you're no longer able to do this, and uh, payers are becoming more in tune to people who are aging and they might need some different help. Even if the person who transferred you now is older, they're willing to get you something to transfer that that other person is using, but it's transferring you. So it goes on your bill and it's for your benefit. So they're getting much more in tune. So if you can't get into your bathroom, if you can get a lift to transfer you, it helps transfer you into your wheelchair as well. Helps transfer you on and off. You could get a commode if you can't get into the bathroom. A shower chair fits nice over a toilet. If you have an accessible shower, you can have your bowel and bladder program. Then you can uh, transfer, go right into the shower, get cleaned after. It's a nice little one-step process if you can get all that kind of equipment. But that would probably be the best thing. Now, if all else fails, you can always get into bed and do your bowel program, always laying on the left side, but you don't have the advantage of gravity. And so it takes a lot longer. And then, you are having your bowel movement in your bed, which, some people, do not find enjoyable because they don't want to do that in bed. So that's probably the best is you get some kind of a lift that will help you. They do have those very expensive ceiling lifts that will move you about in your house so you can, go to the toilet and then it will move you over to the shower, it move you in and out of bed. Those are very expensive and those are a little bit harder to get, but I want you to know that that is an option. And then at night, they're having AD at night with spasms from their hip to the middle of the foot, including leg jerking, can't sleep more than an hour. And so they're having trouble with spasms at night. So you might need some spasm medication. That might be an issue because that's what that sounds like. It could be something else though. So you might want to check. Could be like something like restless leg syndrome. Just because you have paralysis does not mean that other things don't happen. But hopefully, it will be that it's some spasms, so you might need just a little touch of medication to help settle that so you can get some sleep because that's waking you up. And then procedure from turning on from their side. So if you can't turn yourself, somebody will need to help turn you. There are beds that have a turning system within them, so that might be another option as well. Again, we're talking about that's expensive stuff. But sometimes you can get one of those triangle things that go over the bed that might, you can pull on that bed rails. If you can grab onto the bed rails and pull your body, if you're not able to turn yourself, then you're probably going to have somebody help turn you at night. There might be a different pressure dispersing system that you can get with alternating pressure underneath you that can help modify, sometimes a side goes down and then the other side goes up. So it helps divert that. So you might look at to different pressure dispersing, upgrade your equipment there. And again, with your aging, you should be able to get these kind of things. Here's somebody who wants more about bladder options. They cath themselves, but they've never had a bag. They went to the urologist who pretty much dismissed about other option. I go out almost daily and become paranoid about accidents. So, um, you shouldn't be having accidents. We know that. And if you're doing intermittent catheterization, you shouldn't have to have those. Sometimes people who are not that familiar with paralysis from brain or spinal cord issues or neurological disease, sometimes they don't see that many people with spinal cord injury. So get the bladder book and look at the from the Reeve Foundation. Look at what all the options are. You might want to go back to that doctor and tell them you're worried about accidents. Go with a little chart if you've had accidents, because you shouldn't be having those. You might need a urodynamic test because, as I was talking about earlier, sometimes the bladder and the sphincter, the urinary sphincter, get out of sync, and sometimes things aren't working. Maybe the bladder's squeezing, but the sphincter's still open, so there's an accident. So go prepared with your knowledge. If you want to ask for a different urologist, you might ask your primary care doctor if there's somebody more familiar with people with urinary with paralysis. That might be another option. But there are all kinds of options with medications, and if you start worrying about, and you already have, that is an a, a showstopper. You can't be worried about that the whole time. Now, I don't know if you're a male or female. So if you're a male, there are external catheters that you can wear in between catheterizing. If you're a female, pads that some females use, we don't recommend them because of urinary tract infection. You're sitting on that moisture, your skin's going to break down, so so we need to get this in order. I don't know how often you cath. You might need to cath more frequently, and be sure and look at what you're drinking. So if you're drinking freely, you might need to control the amount of fluid that you take in. If you're drinking sodas, power drinks, diet sodas, I'm going to put alcohol in there. Doesn't mean I'm not saying anything about alcoholism. I'm just saying all these drinks, those power drinks, a lot of the fancy waters you have in the store, they all have sugar in them. So if you're drinking something to boost your energy and you're getting, one of these fancy water drinks, that will have sugar in it, and the urine will roll right through. Caffeine does it the same as well. Smoking can affect how your urine's coming out. So you might need to go back and look at your traditional bladder management program where you're only allowed to drink so much fluid every hour. So your bladder doesn't fill up real quick and then contract, and then you have an accident. So it stays more at an even keel until you catheterize again. Our bladder book will explain all this to you, and you can use those techniques. But you do want to talk about urodynamic testing, because as we age, and as you develop along in paralysis, your bladder and your bowel changes. It just does. And so you might have a different functioning bladder than the way it used to function before you had these issues. So you need to have that testing to see what the problem is. So you can control the problem and not just treat the symptoms. Here's somebody else who's having uh, they have a spinal cord injury that affected the right side of the body, include their hands and feet with numbness and severe foot pain. So that sounds like neuropathic pain. So there are treatments for pain control. There are all different kinds of treatment. By golly, we have a book for that too. We have booklets about everything. So talk to your healthcare professional. You might be having neuropathic pain that can only be treated with neuropathic pain medicines. So taking an aspirin or an ibuprofen is not going to help. It might make you sleepier. It might take the edge off, but it's not going to control the pain. Opioids, narcotics are not going to control the pain. There are medicines that are created just for this particular thing that control the pain. But there are other non-medical treatments as well, and they're all outlined. I can't go into them all right now because there literally are so many. There's a lot. So, if you there's 2 drugs that were, invented for neuropathic pain, gabapentin and pregabalin. The brand names are Neurontin and Lyrica. Those are really strong, powerful drugs. You might not need that strong of a drug. So there is another alternative for medications, and one is that people who have seizures who get neuropath don't get neuropathic pain because they take seizure medication. So if you take seizure medication, now like those people who have seizures, they might take medication like 200, 300 milligrams. But what they found is because there's this side effect, you might take a milligram and it won't do anything for seizures. You don't have seizures. You don't need to be treated for that. But a milligram to 5 milligrams, maybe up to 10 milligrams, that will just take that neuropathic pain away. The same thing for anti-epileptic drugs, but in small amounts, like the seizure medication, the anti-epileptic drugs. So it's just kind of interesting that, it's a side effect of that drug, but you take a little tiny bit and it treats your pain. So I'm hoping that you look into that because there's all kinds of things. If you don't want to do medicine, there's biofeedback, there's hypnosis, there's just all kinds of things that can help with neuropathic pain. There's a question somebody wrote in here about their wheelchair. Any guidance on stand-up wheelchairs and companies that may be covered by insurance? Well, insurance covers what is in your insurance contract. So when you get insurance, you have a contract with that insurer, and they will tell you what they cover. For some people, it's really difficult to get a standing wheelchair. But if you need one because you can go to work or you need it because you need to work around in the kitchen to prepare food for your family, you can get it for different kinds of reasons. Now, if it's not in your contract with your insurance company, you're probably not going to get it. But if you work with your healthcare professional who will work with your case manager, everybody has a case manager who has insurance. Well, you don't have one until you request one. And then when you get that case manager, they can help organize your care. So they manage your whole care from the insurance point of view. They are representing the insurance company with your case. So they are working for the insurance company. That's important to remember. So I always tell people to talk to their primary care doctor. They will write a letter of medical necessity explaining why. Maybe you need one because of bone density issues. And when you're standing, that sometimes helps bone density. Maybe you need one because you can go up and down in that, and that will help with the going up and down. That will help stir up your bladder and maybe help urinary tract and reduce urinary tract infections. It may help with your bowel program. It may help with your vascular system because your legs will be moving in a certain way. So there's all kinds of things, but you have to have a medical reason why it is. Usually going to work will help. If it's something like, well, I just think it'd be cool so I could stand up with people, that should be a primary reason, but oftentimes it's not. So be sure and have your healthcare worker work with your case manager. Call the number on the back of your card and ask for a case manager to be assigned to you, and they'll probably contact you. Be very, very, very careful what you say because, sometimes people who are not in the business might say something that seems like a legitimate reason for something, but they'll remember that you said that and it could work against you. So just be very careful what you say. And usually it's better to have the doctor, but if you know the name and number of the case manager, you can provide that to the doctor. Anybody with paralysis should have one. Some are automatically assigned, and you call the number on the back of the card, you'll find out who the case manager is. Some you have to request a case manager. So everybody should have one because that really helps. Um, so somebody's asking about finding caregivers with possible grant money because they're very expensive. That is so true. So if you can't have insurance pay for it, and what insurance pays for is very limited. So the best thing to do is to work again with your primary care physician. Say that you need help with these certain activities. Sometimes they'll allow somebody to come in to do the bowel program in a bath, stuff like that. Sometimes they'll, if you're on a ventilator, they might allow so many hours of care. Unfortunately, these things all fall to family members, and we need to work on that system a bit. But talk to your primary care physician, get medical reasons why you need these, and you might have some success. Now, here's somebody who's experienced AD when they lay down on their back, and it used to not happen, but now it does. And so I read this question before, and I was just thinking, wow, this is really fascinating because usually AD happens for some body irritation. So why does it happen when it lay down on your back? And so I was trying to think maybe that you have tone that that you don't see because on your back, you don't really see your back. And so maybe you're having some kind of muscle spasms that are in your back. Or I was thinking maybe trying to think out of the box. And I was thinking maybe it is because people have a seating cushion that is pressure dispersing. So, but do you have one on the back of your wheelchair? So if you're just on a regular sling back on your wheelchair, maybe that's irritating your back, and when you lay down and stretch out, that's causing that something to be your muscles are irritated because your muscles are stretching out differently. Or maybe if you have a back wheelchair, and you're holding your upper body up, maybe that's fatiguing your muscles in there. Maybe it has something to do about changing position and your catheter is kinked for a little while when that's going on. The number one reason for AD is blocked catheter, number two is a clogged bowel, and number three is something irritating your skin. So those were kind of the things that I was thinking about because I just found that question just was so phenomenal. I thought, wow, everybody needs to know about that. Somebody wrote in and they said that they were newly injured, and I thought, oh my gosh, they just are lost going around trying to figure out what to do. And for those of you that have been out for a while, you'll be like, oh, yes, I know about this. And I'm so happy that you wrote that in. It wasn't really a question, it was a statement, but it just I was so happy you brought it up because people need to know, you're in the hospital, it's set up, everything kind of, comes to you, it's time to do this now, you get a catheter kit, it's all pulled together. There's so much assistance while you're learning. You get home and all of a sudden it's like, oh my gosh, start out by making a list of everything you need to do and do it for a while. But as you go, you'll learn to get your catheter supplies all collected in one spot. You'll learn to have a go bag. So when you go outside, you have everything that you need. If you need to catheterize while you're out in the community, you'll have all those kind of things. If you're going to be gone while there's medication, you'll know to put that in your pill box. So those are all kind of helpful things. A great things to do would be to contact the Reeve Foundation, the peer mentor group, because these are people are living successfully with what you're going through. They'll match you by age, they'll match you by gender. They even try to put you if you're in the same city so you can meet up. But these are people who are not going to tell you what to do. These are people who have been educated to listen to you, to hear what your problem is. Now they'll have suggestions because they talk to other peer mentors, and they might say, well, you know what, this me, you might want to try this. It is up to you to decide if you want to try that. And if you do or if you don't, it doesn't upset your peer mentor. You just keep working with them, and they'll give you lots of helpful suggestions for just how to make it through the day. What's some good tips? What's some good time saver? Where's a dentist that has a wheelchair accessible office? They just have all kinds of information, but mostly they'll just be your pal and listen to you and understand because they've been through it and they'll understand what's going on. And it sounds like you're ready to have one for that situation. So, how do we know if bone density drugs are going to work on us? You won't know about their working until you have your bone density test. There's no other way to figure that out. So you just have to go. They're slow. They don't, it's not like you take them for a week and oh, everything's all better. It might take 6 months. It might take a year to get your bone density back up again. Oh, are there peer mentors in Canada? I really don't know the answer to that, so shame on me. I can't imagine that there's not, but, they Zoom, they talk over the phone, so they'll find somebody for you, trust me. That is the thing. I can't imagine that they don't. I've never met a peer mentor for Canada, but gee, that's a great idea. So they'll hook you up with somebody, Zooming, talking on the phone, all those kind of things, those work too. So I know some people that have peer mentors and I mean they are best buds. So it's a very nice situation. Now, if you get a peer mentor and it's just not working out for you, don't feel bad. Call back and say, this just isn't working out so well for me, and they'll be happy to switch a peer mentor for you. So don't think, if sometimes people just don't click. These people have been educated, so they know what they're doing, and so it usually goes pretty smoothly, but don't worry, things happen. It's just the way life is. And I can see that we're well over time, so I better stop talking now, but I thank you very much. I hope come see me in Denver. I'll be there. I'll have a table. I'll talk to you about anything you want to talk about one-on-one. So if you're around Denver and you want to come to the summit. It is always fabulous. Lots of educational information, lots of opportunity to get more information and make life a little bit easier. To meet the people from the Reeve Foundation, it's really great. So with that, I thank you for coming today, and I'll see you in Denver. If not, I'll see you at the end of next month.